If you're like me and you suffer in pain, you probably look for a lot of different solutions. Well, I've got something you're going to want to watch. Please welcome to the show Dr. Phillips. Doctor, you are not only a doctor, but you're an inventor.
Yes.
A very remarkable product. Yes. Tell me about it.
It's called the ReBuilder. It's designed to rebuild the nerves in your peripheral nerve systems, your feet and your hands primarily. It analyzes the nerves and then it repairs the nerves.
This has been, just a couple of minutes ago before we started filming here, all you did was have me put my feet in warm water with Epsom salts, minerally charged, turn this on, I felt a little tingling. I always have a pain in my right foot, like literally a searing pain. I was told I have two options, cortisone shot and drugs. Oh wait, no, the third one was to put an orthotic in my shoe. Oh, that's right. No one mentioned that there might be a thing like the ReBuilder. Why is that?
The drug companies have a much bigger budget than we do. Okay. And so we doctors have been trained in doctors of medicine, not electricity. And the nerves operate on electricity.
Well, that's fair. So what happens when you have neuropathy? What's actually going on?
What's going on is that the nerves are not transmitting their electrical signal from one nerve to the other. The nerves don't touch each other. The signal has to travel down a nerve, jump a gap called a synaptic junction, a fluid-filled gap, go to the next nerve, and it works its way all the way up to the brain. And if there's a problem in either the part of the nerve that picks up the signal at the skin, or the nerve cell itself, or in the axon that sends a signal to the synaptic junction, or if the synaptic junction is not properly mineralized, all these things can cause the effect of not feeling the pain or feeling too much pain.
So you just said a whole lot of big words. Basically, if I'm numb and I'm tingling or I can't feel anything, I'm in trouble, aren't I? It's going to get worse with time.
It's going to get worse. It's a signal that things are getting worse. And peripheral neuropathy of your feet and your hands can progress to the abdomen, and you can get peripheral, you can get neuropathy of your internal organs.
Well, that sounds terrible. So the point is, if I'm suffering, and typically it's somebody who might have diabetes, who's gone through chemotherapy, but there's a lot of other reasons you can end up with neuropathy, correct?
It can be a side effect from drugs, statin drugs to reduce cholesterol.
And how do you know this? So all of a sudden you get a little tingly, is that how it starts?
Most people get a little tingly, or they get their feet start to burning, or they feel a little bit of imbalance because they're getting numbness on one foot more than the other, and they stumble.
And you have a very personal reason for designing this product, don't you?
Yes, my father developed peripheral neuropathy. Primarily, he had open heart coronary artery bypass surgery, and they take the greater saphenous vein out of the leg and use it for grafting material. But that reduces the blood flow. So in that case, the reduced blood flow starved the nerves, and they started to die off. So we restored that. We fixed the nerves and increased the blood supply.
So most doctors don't offer this, but you've created an army of doctors who are very sophisticated, understand this, and offer the product, correct?
Yes.
And so we come to you, and what do we have to do?
Well, if you can either go to our website and you can buy it right then and there, we will then arrange, it's a prescription device.
Okay.
We will either arrange to communicate with your doctor and get a prescription, or supply a doctor who will give you a prescription, and then we'll send it to you and you can use it at home.
So I just experienced this for the first time. I always have a throbbing between my second and third toes. I don't feel that right now. I actually feel overall completely wonderful.
Yeah, you feel great.
That's the side effect of your product?
That's the endorphins. It's like people say, as if they say, I feel like I've had a glass of wine.
So if a doctor doesn't offer this yet, would you look in my camera over there and tell them what they need to do?
You need to talk to your patient. You need to get one of these. You need to demonstrate it for the patient, and then either stock them and send them home with them, or send them to our website, rebuildermedical.com, and have them order it directly sent to their house.
My dad was an inventor. He used to look at things that could be and make them happen, but he never got his inventions out to the world at all, so I applaud you. How did you come to invent this?
Well, the technique I use is a slight form of self-hypnosis. I give myself the problem, and then usually in the shower, it comes to me fully developed, and a three-dimensional image, like a hologram, and then I reverse engineer it. So that's how the device comes to me. And then, of course, goes through all the process of building it and things like that.
How many devices have you created?
Maybe 12.
So congratulations on this. It's amazing. How long has this been around?
28 years.
You have over 1,000 doctors who use this in their practice.
Probably 10,000. Yeah.
10,000. Can you share with me how it's changed their practices?
It makes it much easier for the doctor because he can train his staff to perform the demonstration, so he doesn't actually have to do a lot of hands-on.
Right.
He can reduce the side effects from the drug so the patients don't keep calling him over and over and say, now I'm vomiting, my memory's going down, my sexual function is decreased. He doesn't have to worry about that.
Because those are side effects from some drugs.
Yes, so he doesn't have to deal with that. In addition, one patient refers another patient. He can get more patients in a fewer amount of time.
Up until now, how have people heard about you?
One person to another.
Okay, I'm not a doctor, but if I had access to a product that would make my patients affect their pain in such a powerful way, I would definitely incorporate this in. Why wouldn't you?
Those doctors that do try it get the same results that you do, and they're very excited about it.
Well, I'm very excited about it. I'm very excited that you're offering this. And if you are a physician who does not have this in their office, but you do treat neuropathy, you do treat nerve pain, this is something you need to explore. Always keep your options open, right?
And you like that, right?
I do. I love it.
Then it's a gift.
I have no word. Wow, you're going to make me cry because I will tell you, when you are in pain, and if you are a patient who suffers like I do, I'm at a point now, see these high heels? I really can't wear them because I'm in so much pain all the time.
You were.
I was. Wow. All right. Well, so here's the challenge. Check back with me in a little bit and let me post to my social media how you've actually changed my life.
Well, good.
Thank you so very much for today. Wow.
You're welcome.